Hi guys, welcome back to our channel, and today we're going to be talking more about breast cancer. Let's get started. So, what is breast cancer? Cancer is defined as abnormal cells that attack the healthy cells in the body. And for breast cancer in specific, cancer cells in the breast will start to attack the tissues near them, and they're going to start to metastasize or spread to the rest of the body. Some symptoms or signs of breast cancer are tenderness in the nipple, texture of the skin changing, or a lump in the breast, even though not all lumps are cancerous. On the right, you'll see a diagram of what a breast would look like from the inside if you do have breast cancer. So now let's talk about the risk factors. Risk factors cannot be controlled and can be controlled. So it's important to remember that because some you can control and change, but some there's nothing you can really do about it. So risk factors that cannot be controlled are gender, age, race, obesity, family history or genetic factors, and health history. To talk more about these, for gender, women are more likely to get breast cancer, even though men still do get breast cancer. So make sure you know that, because if you're male, there's a chance that you'll get breast cancer, but it's more likely for women to get breast cancer. Also, if you're in the age group of 40 or above, it is way more likely for you to get breast cancer at this age. So it's important that if you're a woman and that you're over the age of 40, that you get your regular mammograms and you start to make sure that you know if you have breast cancer or not. Some risk factors that can be controlled are the lack of physical activity, poor diet, or drinking of alcohol. So it's important that you make sure that you can control these properly so you make sure that you reduce your risk of breast cancer. Remember that having a risk factor doesn't mean that you will get breast cancer, but it does increase your chance of getting breast cancer. So now let's talk more about the types of breast cancer. So we first have ductal carcinoma in situ. This is the lining of breast milk ducts containing abnormal cells, which is a non-invasive type of cancer, and it's likely to be treatable during its early stage. Then we also have lobular carcinoma in situ, which is an invasive type of cancer where the lobules of the breast contain abnormal cells, but they have not spread to the breast tissues. In these images, you can see what is going on inside the breast when you do have this cancer, and it compares normal ducts or normal lobules to how it would be with the carcinoma. Now, to talk more about other types of breast cancers, we have the invasive ductal carcinoma, which is an invasive type of cancer where abnormal cells in the lining of the breast milk ducts start to spread into the breast tissue. This type of breast cancer makes up around 80% of diagnosis for breast cancer, so it's very common. We also have invasive lobular carcinomas, which is an invasive type of cancer where abnormal cells in the lobules of the breast start to spread to surrounding breast tissues and throughout the blood. So in this picture, it's kind of comparing the two and how it looked like and how it looked like inside your breast and how the cancers are kind of different. And to talk about the last two types of breast cancer, we have inflammatory breast cancer, and this is where cancer cells start to penetrate the skin and lymph vessels, and it's known as a very fast-growing and aggressive type of cancer. So this is very aggressive, it's going to grow really fast, and the picture towards the right on the top kind of shows the growth of that. And next we have the metastatic breast cancer. This is when cancer in the breast has spread to other parts of the body, which is also known as stage 4 breast cancer. So it's going to spread throughout the body, which is really serious, and this is going to make cancer like even more big in your body, and it's really important that it doesn't get to this stage, which is why you should be getting you should get your yearly mammograms and make sure that you keep your body in check. Thanks for watching. Our Instagram is at Project Think, and make sure that you follow us and that you keep watching our other videos. Thank you so much. Bye.